as we know that in all the accredited NHIF hospital, in most public, I'll talk about the public hospital, NHIF does not cover ICU bill. NHIF does not cover ICU bill. For that, it only covers the bed charges alone. Hello guys, hi everyone. A very good evening to you all and a warm welcome to Health Insurance Kenya. My name is Nyambura Winnie and welcome back to my YouTube channel where we get to educate and learn more about insurance cover, especially NHIF, which is the most affordable, the most used and the most popular here in our country, Kenya. And so guys, today I want us to talk about inpatient using NHIF. So you are all welcome, and also guys, allow me to say thank you so much, and God bless you to those who are showing their support. Thank you for the love, thank you for your continued support. Thank you so much, because it's that support that motivates me and allow me and makes me to make motivate me to make more and more content, to bring you more and more content. So guys, at this topic, as I have said, we are going to talk about inpatient using NHIF. And the reason I decided to talk about this is because many of you don't differentiate when it comes to using NHIF, that is in inpatient and also outpatient. And because we have talked about outpatient so much in my other videos, so allow me today to talk about inpatient using NHIF. And I'll start by saying inpatient is when you get sick. Inpatient is when you bring a sick person to the hospital to see a doctor, and when you get to see a doctor, the doctor does his or her consultation and also examination, and after that the doctor's report recommend that you need to get admitted so that the doctor can monitor you closely, so that you can get the nursing care, you can get you can be monitored, and also you can receive further treatment when you are there with the doctors. And that's what we call inpatient. That is when you get admitted, when you are taken to the ward and you get to stay in the hospital. And also kwa lugha ya Kiswahili, inpatient ni ule wakati unapokwenda hospitali ukiwa mgonjwa, na baada ya kumwona daktari anatoa mwelekeo wake ya kwamba utalazwa hospitali ili ukaweza kupokea matibabu kwa ukaribu, ili ukaweza kupokea matibabu na ufuatiliaji wa kina. Na kwa lugha ya Kimombo, sisi kama Wafaransa tunasema gukoma thibitari, kana rĩrĩa mũrwaru waku akomete thibitari. That's what we call inpatient. And so guys, we're talking about inpatient using NHIF cover. And when you get to be admitted in the hospital, when you get an admission in the hospital and you know that you have NHIF cover, the first thing that you do is to notify the hospital that you have NHIF cover, even if you don't know whether it's active or not. Especially there are those people who work for private company, they don't even know that they have an NHIF cover. Some of them come to the NHIF office, and when they say that they want to get treated or they want to register for NHIF, but when you ask them for their ID, you get to see that they already have NHIF cover, which is being paid by a private company. That is where they work. So the first thing that you do when you get admitted is to report to the NHIF office in that hospital that you get admitted, or in that hospital that you get to take. It might be your relative, it might be a friend, a close friend. So whenever they get admitted, just make sure that within 24 hours you report to the NHIF office in that hospital, so that they can get notified in the system. And that means that the NHIF will start working from that moment. And by the time they get discharged, they will be able to use that NHIF cover will be able to cover for their bills. So guys, also there are those people maybe who get admitted. Some of them are unconscious, and when they get maybe by the time they were being brought to the hospital, they had no one. Maybe someone just came across a person lying maybe by the road, and they get to bring them to the hospital. They don't know whether they have NHIF cover, maybe they don't know their names, because things like that happen oftenly in the hospital. And so guys, sometimes you see when you get ukijisikia you see umeletwa hospitali kama uko unconscious, so ile wakati umejisikia and you know that you get to say your names, or maybe you get to give the doctors your relative's number, and they get to call them. And then when you come and you get to ask that person whether they have NHIF cover, and so that they can report, so that they can notify the hospital that you have NHIF cover and your bill will be sorted. Also guys, there are those who come to the hospital, you get admitted, and maybe you forgot to notify the hospital, you forgot to let the hospital know that you have NHIF cover, and then you stay like 1 to 3 days, and the next day, that's when you get to notify the hospital. Let me tell you that day that you get to notify the hospital, that is the time that your NHIF cover start, or your NHIF cover will start paying for all counting. I don't know, will start paying for your bill up to your stay in the hospital. And so that means that for those 2 or 3 days that you didn't notify the hospital, NHIF will not cover that bill. And that is when you get to see that you are told that you came on date 1, you notified the hospital on date 4. So you are told that from date 1 to 3, you will get to pay your bill cash, because the NHIF know that from day 4, that's when they have a patient who got admitted in a certain hospital. So guys, every time that every time you come to the hospital, you get admitted, just let the doctor, or let those nurses who come to monitor you, or to check how you're feeling, let them know that you have NHIF cover, whether it's active or not, because sometimes you say people don't even realize, don't know what is to be active, because sometimes you'll see a patient amekuja hospitali, maybe kadi yake hajalipia for 4 months or 5 months, and then just because that person knows that their card is not, or then their NHIF cover is not active, so wanasema mi najua sina kadi. But if you made inquiries, if you got to ask someone, maybe ugesaidika, because when you have a cover that you have not paid for 2-3 months, that cover you can be able to reactivate it, or to add those to pay for those months that you failed to pay, and also pay for the penalty, and your card get reactivated, and you will be able to use that when you get discharged. That is, that NHIF cover will help to pay for your bills. So even if you know that you have not been paying for it, you just ask juu wanasemanga kuuliza sio ujinga. So guys, yeah, and also I will talk about ICU. NHIF cover mostly doesn't pay for ICU bill, because sometimes that also become a problem. You see, a patient get admitted in the hospital, and when they are getting discharged, they are told that their bill is covered, and then maybe that person gets to stay for some few days or a week, or maybe the days they get to stay in ICU, and then they are taken to ward, and then after they get discharged, they are told that there is a bill that they're supposed to pay in cash, and then it becomes like a confrontation. Then it becomes like the patient don't understand why they paying cash, of which they have NHIF cover, of which they notified the hospital immediately they got an admission. So guys, as we know that in all the accredited NHIF hospital, in most public, I'll talk about the public hospital, NHIF does not cover ICU bill. NHIF does not cover ICU bill. For that, it only covers the bed charges alone. I repeat that again. NHIF in any public hospital, it has an ICU unit. When you get admitted there, in ICU, NHIF covers only bed charges. All the other bill, that is the drugs and everything and every service you receive in ICU, you get to pay for it with your own money. And so guys, that's about inpatient. And in private hospital, I'll not talk much about private hospital, because in most accredited private hospitals, sometimes you hear people saying that, oh, NHIF only covered bed charges, NHIF didn't pay for everything when I was admitted. You get to see that the reason is because every private or every hospital has its own contract with NHIF. So if that hospital have agreed or they have a contract that is saying they will cover this kind of amount, that's what happens, because it depends with the hospital. You know, some of the private hospital are very they're very what can I call it, maybe ziko juu or something. So you find out that in private hospital, not everything is covered by NHIF, but in every accredited public hospital in this country, when you get admitted, apart from ICU, NHIF covers all your bill, everything. Whether when you are admitted, you got a surgery, whether you got any radiology, that is any x-rays, ultrasound, scans, MRI, CT scan, everything, it's covered. Everything apart from ICU. We're together. I know that I've made that a point clearly, and that everyone or all of you have understood that. And so guys, yeah, so there's also something that I wanted to discuss. This is when you get admitted, and then you are a self-employed. When I say self-employed, it's for those who get to pay for their cover, for those who pay for monthly contribution every single month. Those are self-employed. you find out that when you get to the hospital and you get admitted, or your patient or your relative, your friends get admitted, and then you report to NHIF office, you get the you find out that they get to ask you to top up your card or to top up your NHIF cover. The reason you're told to top up, it's because you find out that most of the people, most of the NHF members, NHF contributors, what they do, they pay for their monthly contribution. For example, you pay for 1, 2, 3, 4, 5 months, and then you stop paying for it for like 3, 4 months, and then you come back, you start paying for it, and that's when you find out that most of those NHF cover has a penalty, and when you check at them, they have so many penalties. And then also you find a person was employed by a private company, and then that person lost their job, and then they stopped paying for it. And when by the time maybe you have an emergency or you get sick and you get to visit a hospital, since when you lost your job you did not go on by paying your cover, then your cover has some month that is not paid for late and also penalty. And but when you're told that you're getting admitted, that is when you get to pay for your NHF cover. You reactivate it immediately, and your card becomes very much active. And then when you go to NHF office in that hospital that you're getting admitted, you see those staffs that work in those department. They ask you to top up your card. Why do you think they ask you to top up your card maybe to a certain period? That is period. It's because they have seen your card, how you pay for it. So it means when you get admitted, you will use your cover, but when you get discharged, that's the time you stop paying for your NHF cover again. And so guys, there's something I want you to know. For example, I will give an example in a certain hospital. Let's take a hospital like Vika level 5. In Thika level 5, we have NHIF branch. That is where all the claims, all the hospitals around that place are being paid or are being taken. And so you find out that there are so many hospitals, like there are so many hospitals. I won't name them, but we have Kiadutu, we have Thika level 5, we have Moi Avenue Hospital is a private hospital. We have Thika Nursing. We have so many around. We have Mary Health. We have so many of them around there, and all those hospitals take their claims in that NHIF branch. NHIF branch that is located at Thika. So you find out by the time they are going through all those claims in for every single patient in all those hospitals, it takes some time. So by the time they are paying the hospital, it's like 2-3 months. And so if you got admitted, and then by the time you're getting admitted, your card was well paid, was well active, but by the time you left the hospital, when you got discharged, you didn't go on paying for your card. You didn't continue paying for your card, and that was the moment, or that is the moment you stop paying for it. And when your claim is taken to NHIF for payment, by the time they are paying for it, or by the time they are going through all those claims, they find out that your NHIF cover is inactive. And you know what? NHIF NHIF will not pay for your claim in that hospital, because that's where you see like those staffs, me being one of them, you find out that claim it's returned back to the hospital, saying that the claim is have the NHF cover for that person have arrears or has so many penalties, is not active. And if the hospital said it's to contact you or to reach out to you to pay for NHF cover so that they can get paid, you find out that it's impossible. Maybe by the time you are getting admitted, you gave out a wrong phone number or a wrong contact, and so it become impossible. So every time you get to the hospital, you're the one who pays for your NHIF monthly contribution, and you're told to top up for your cover for some period. Know that is the reason. But for those who are employed by the government or the private company, they're not told to top up, because whether you are admitted or not, whether you go to whether you're in leave, you are on leave, they still pay for your cover. And guys, that is the end of this topic. It's the end of this video. If I forgot to mention something about Inpatient, kindly comment down below. And also guys, there's so many people who are calling me to ask me question at what will they do with their cover. Maybe they want to do some payment, maybe they want to reactivate their card, maybe they want to add spouses or to add dependent like children. Kindly, I know it's good, but also do it. And if you have something that you want to ask me, ask in the comment section, so that at least, by commenting, you're also supporting me. And that support, I need it, because I feel motivated. Like I said in the beginning, I feel motivated to make or to bring you more and more content. And so guys, like I assured you that there's more to come. So guys, also please do it in the comment section. Don't forget to subscribe. Continue subscribing. Continue supporting by liking, sharing. Also, don't forget to give this video a thumb up, and I will really appreciate. And also guys, don't forget to hit that subscription button, so that at least every single time I upload a video, every single time I upload a content, you will be among my first people to get that video. You'll be the first people to watch that video. And guys, thank you so much. God bless you. God bless you so much. Thank you for your time, and let's meet again in our next video. Bye.